Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa and today we're going to be going over TIELLE Plus. But first, if you could smash that subscribe button, it would be greatly appreciated as it truly does help my channel. So let's get started. So this is an adhesive foam dressing composed of 3 layers. So it has a hydropolymer foam, a super absorbent wicking layer, and a polyurethane backing. It does have an adhesive border, so it does stick. It is flexible and may be used as either the primary or secondary dressing. So indications for use. So this can be used on wounds with a small to a large or copious amounts of exudate. And it also can be used under compression wraps. Some precautions, it can be used on wounds that do have signs and symptoms of infection as long as they are being treated. And contraindications, we're not going to use on lesions with active vasculitis, and we're not going to be using this on full thickness burns. So first we're going to choose the dressing size that fits the wound. So we want at least a 1 centimeter overlap onto the peri-wound skin. Okay, once you have the dressing of choice picked out, we're going to cleanse the wound with normal saline, and then you're just going to dry the peri-wound. You can apply a skin barrier at this time if needed. And then you're going to partially peel back the sides of the backing paper and position the pad over the wound, ensuring the 1 centimeter overlap, it's correctly on there. And you're going to smooth it into place while peeling the other half of the backing off. If it is waterproof, this dressing, but you can add petroleum jelly to the outside of the dressing borders just to add additional water repellency if that's needed. So to remove this dressing, we're just going to gently lift up on one of the corners and gently remove the dressing. Now for people who have fragile skin, lift up one of the corners and apply a little bit of normal saline to a Q-tip, and as you're lifting it, just kind of lift it with the Q-tip, so you're kind of pulling back, lifting with the Q-tip, and it will peel back a lot nicer, just so that you're not causing skin tears on that fragile tissue. Frequency of dressing change. So it can be left in place for up to 7 days, but this is dependent on the amount of exudate. So when the exudate comes in contact with the wound edges, so the foam pad, not the actual adhesive part, but the foam pad, once it comes in contact with the edges of that, we want to be changing the dressing. The expected outcome of using this dressing is that we have no skin, peri-wound skin maceration. And it does come in the different sizes. So the first one is the total size. The second number is the actual padding size, okay? So that's all here. And there is one for the sacral and heel area. So that's all I have for this video. I hope you did find it helpful for your daily practice. And if you haven't done so already, if you could please hit that subscribe button, it would be greatly appreciated, as it truly does help my channel. And then I'll catch you in my next video, guys. See ya.